Hi, I'm Dr. Randall Thomas from Orthopedic Foot and Ankle Center here in Columbus, Ohio. Today we're going to talk about minimal invasive bunion surgery. Bunions are a very common condition seen throughout our population. They can be very painful, progressive, and really debilitating in some ways. Patients can have difficulty fitting into shoes, start to lose interest in activity because of pain, and seek care from healthcare providers. Traditionally, bunion surgeries have been very difficult. Patients have described very barbaric recoveries, big open incisions, a lot of time off their foot for recovery, chronic stiffness and pain, difficulty ever getting back to their shoe gear and activities. Not uncommon for patients to come in and say, I had a family member or friend have a bunion surgery 10, 15, 20 years ago, and I'm never going to do that. And it's unfortunate because still a lot of practitioners are doing the more traditional open procedures. Now, there certainly is a time when open procedures are appropriate, but when we can, we try to employ some of the minimal invasive procedures. The minimal invasive procedures are advantageous for patients because it's less downtime, less risk of recurrence, less pain, better cosmetic outcome. One of the biggest, most important factors are we're not having to go in the joint. The joint is covered by a capsule or balloon. We are going around the joint making bone cuts, and we're not disturbing it. That allows us to have less stiffness, less chronic pain and inflammation. If you go into a joint, you're going to have some rigid findings over time. Also can progress arthritis. So the minimal invasive techniques allow us to do this. Certain patients are candidates for minimal invasive surgery and others aren't. You have to do an appropriate physical exam and imaging with an x-ray to determine this. As minimal invasive surgery has become more in vogue over the past 4 or 5 years, we're seeing that the minimal invasive surgeries are done on patients that probably weren't candidates for it and it's failing. So as we see the data improve, as we look through our patient sets, we're seeing really good outcomes as long as we pick the appropriate procedure for the appropriate patient. Really, the technology on the 3rd generation of minimal invasive bunions is technology built for the patient. We're not trying to put the patient around technology. We have the right technology to do this in a minimal invasive fashion with less downtime and less pain. The typical recovery for this is walking the day of surgery, which is a big improvement from 6 weeks non-weight bearing and cast with our traditional surgeries. By 4 to 6 weeks, we're back in shoes. We're doing some rehab exercises on our own and getting back to activity very quickly. We're seeing patients come in regular shoes around 4 weeks, sometimes even take off their dressings and come in regular shoes earlier. Not that we suggest that. We're seeing them get back to sport and activity within a couple of months, and we're not seeing the complications long term. My journey in minimal invasive foot surgery started in 2018 on my first live patient. However, I trained on it from 2011 on. This was throughout the United States and even in other countries. And we've seen a real improvement with the training. We've had providers come through training with me. They're now practicing throughout the United States, even in Japan and Australia. And everyone's getting really good results. Some of it is technology, some of it is patient selection, a lot of it is the training and techniques that we're employing for these patients. It's a nice option because patients don't have to do general anesthesia. They can do twilights or even be awake for it. It's a much quicker surgery. We've gotten these down to about 30 minutes reproducible. There are multiple different systems for this. So depending on what type of bunion you have, we can employ different systems to try to get the outcome that you want. Very reproducible. And again, the biggest thing is not to have the recurrence. One of our goals of minimal invasive surgery is not to go into the joint itself, to make these bone cuts around it, which leads to less arthritis. We go into the joint, we see arthritis, and it's not uncommon for patients to come back and say, I had a bunion surgery in my 20s, now I need another surgery on the joint in my 40s or 50s. The hope is that long term we're going to have better outcomes because we're not disrupting the chemical balance of the joint or the actual joint itself mechanically. In order to have a good outcome with minimal invasive surgery, you want to avoid doing this on patients that have hypermobility. Hypermobility occurs at the joint where the long bone meets the midfoot. Those patients do much better with our traditional procedures or Lapidus type procedures. Not necessarily Lapiplasty, but a Lapidus procedure where you're doing a fusion or permanently putting the bones together at the base of the long bone in the midfoot. Adjunct procedures can help as well. Doing procedures to the soft tissue to balance this, making actual bone cuts in the big toe itself, along with the bunion procedure, can give a more pleasing cosmetic outcome. Unfortunately, we still see a lot of patients that come in and say, can there be any revision to the surgery? Although I don't hurt anymore, I still have this contracture or my toes overlap or I'm having difficulty fitting into shoes. Our plan is to not do surgery unless they're having pain, so usually we do conservative care for these patients. It would be nice to avoid seeing them still have a bunion clinically, looking at their foot if the appropriate procedures were employed at the initial surgery. Although we look at x-rays and alignment, they may look appropriate. The foot itself, the patient's not happy with the way that it turned out. There are certain measurements on x-ray, but we don't treat x-rays, we treat people. We want this to fit into shoes, be more cosmetically pleasing, less inflamed, and certainly less painful. As my practice has grown from 2018 with these minimal invasive procedures and having been out in practice for greater than a decade now, I'm having a big focus on minimal invasive bunion surgeries. We're seeing good outcomes, well over 200 patients a year we're doing these on. Certainly doing other foot and ankle surgeries, but with this focus, seeing this be more reproducible, we're getting really good outcomes. We're starting to collect data on these patients and have done some early research studies on this. Along with doing research and trying to advance this, we're working with vendors on making better implants, better techniques, making these reproducible. I'm working on an international study right now with multiple countries where we're building jigs, much like what you would see in joint replacement surgery, where we can take this to surgeons that are not as skilled or have not had as much experience in minimal invasive surgery and make this reproducible for their patients. And I'm hoping in the next couple of years this comes online for patients that have a better outcome. When finding a minimal invasive bunion surgeon, you want to find someone who's done a lot of these over the years. They can have complications, and if you don't know how to handle the complications, it can be a real problem for patients. We can go into chronic pain, multiple surgeries, hospitalizations. So you want to make sure you're someone that didn't learn it at a weekend course and is doing it routinely with their patients to deal with these complications. I've not only gone on to doing primary minimal invasive bunions, but I'm seeing a big wave of revisional surgeries coming in, and these can be very difficult to fix. And I'm not sure patients are happy with having to do multiple surgeries and even convert to open surgeries when these fail. Another concept of minimal invasive bunion surgery is going towards marketing for cosmetic reasons. I would recommend against this. We can do a lot to modify shoes and conservative measures to help patients with cosmetics. Splints at night, taping and strapping, types of injections. There are ways to make this look better without surgery. If we're doing surgery for cosmetic reason, I'm concerned the patient may go from not having pain to having pain. Certainly we would like them to be able to fit into shoes better, but we want to make sure that we're not just jumping to doing what they would call a Cinderella foot or a cosmetic procedure to make the foot more narrow to fit into shoes. I've seen that become a bigger wave and lead to a lot of biomechanical problems, need for revisional surgeries, chronic deformities, and pain. Some patients have sensitivities to hardware and metals, and they know this coming in or they found this out with other surgeries. Fortunately, now we have a way to do minimal invasive bunion surgery with non-metallic implants. These are screws that handle like normal metallic implants, but they're bioabsorbable, meaning they're safe and they grow into the patient's bone and are absorbed by the body. This has less risk of having to take out hardware in the future, certainly less risk of allergic reaction, and gives us an option for patients that have nickel or titanium or stainless steel allergies that we commonly see in the population. This is something that's been used in Europe for quite some time, and we've been using it for several years now after FDA approval in the United States, and have seen really good outcomes from this. I want to make sure that I say from a minimal invasive bunion standpoint, it's not a one procedure fits all. There are multiple categories of procedures, and you want to make sure you're selecting the right procedure for the right patient to get the outcome you want.